Welcome to UMCC, where your health matters to us. Kindly like, subscribe, and share. Medicines come from a variety of sources: nature, laboratories, and biotechnology. Many drugs, like digoxin from foxglove or aspirin from willowbark, have natural origins. Others, such as statins and antihistamines, are fully synthetic, designed in labs for precision and consistency. Biotechnology now allows us to produce complex drugs like insulin and monoclonal antibodies using genetically engineered cells. Once developed, drugs must be delivered into the body. This is called administration. The most common method is oral, but some drugs require injections for faster or more reliable effects. Intravenous injections deliver drugs directly into the bloodstream for immediate action. Subcutaneous and intramuscular injections are used for drugs like insulin and vaccines. The choice of administration depends on how quickly the drug needs to work and its chemical properties. Each method is chosen to maximize effectiveness and minimize side effects. Modern medicine tailors both the source and delivery of drugs for the best patient outcomes. Understanding these basics helps us appreciate the science behind every pill or shot. Next, let's see why we take these medicines and how they work. We take drugs to treat, cure, or prevent diseases, manage chronic conditions, and relieve symptoms. Antibiotics cure infections, vaccines prevent illness, and painkillers ease discomfort. Some drugs, like antihypertensives or insulin, help manage ongoing health issues. Others, like anti-nausea medications, improve quality of life by controlling symptoms. Drugs work by interacting with specific targets in the body, usually proteins called receptors or enzymes. Think of a drug as a key fitting into a lock, activating or blocking a biological process. Agonists turn processes on, like albuterol opening airways in asthma. Antagonists block processes, such as antihistamines, stopping allergy symptoms. Some drugs inhibit enzymes, like statins, lowering cholesterol by blocking its production. Understanding these mechanisms helps scientists design safer, more effective medicines. Every drug's action is carefully studied to maximize benefits and minimize risks. Next, let's follow a drug's journey through the body. How does it get where it needs to go? Before a drug can work, it must enter the bloodstream. This is absorption. Oral drugs dissolve in the digestive tract and pass into the blood, but factors like food or special coatings can affect this process. Injections, especially intravenous, deliver drugs directly for immediate effect. Topical drugs act locally, minimizing absorption into the bloodstream. Once absorbed, drugs are distributed throughout the body by the circulatory system. They travel to target organs but can also reach other tissues, sometimes causing side effects. Some drugs cross barriers like the blood-brain barrier to reach the brain. Others cannot. Drugs may bind to blood proteins or accumulate in fat, affecting how long they act. The goal is to deliver drugs where needed while limiting unwanted effects elsewhere. Effective distribution is key to safe, targeted treatment. But what happens after the drug does its job? After a drug works, the body must remove it. This starts with metabolism, mainly in the liver. Liver enzymes break drugs down into water-soluble forms, called metabolites. Some drugs are given as inactive prodrugs, activated by the liver for better absorption or targeted action. Once metabolized, drugs are excreted, mostly by the kidneys and urine. Doctors monitor kidney function to prevent dangerous drug buildup. Some drugs exit through bile and feces, or in small amounts via sweat, saliva, or breath. How quickly a drug is cleared, its half-life, affects dosing and safety. Poor liver or kidney function can change how drugs are processed. Understanding metabolism and excretion helps doctors prescribe safely. But even with careful use, drugs can interact or cause side effects. Every drug has risks, interactions, side effects, and special warnings. Drug interactions can make medicines less effective or dangerously strong. Always tell your doctor about all medications and supplements you take. Side effects range from mild, like drowsiness, to severe, like allergic reactions. Adverse reactions can be life-threatening. Know what to watch for. Pregnancy requires extra caution. Some drugs can harm a developing baby. Age, genetics, and organ function also affect drug safety. Foods like grapefruit juice can interact with certain medications. Always follow your doctor's instructions and never share prescriptions. Store medicines safely and read labels carefully. Being informed is your best protection. The science of pharmacology helps us use medicines wisely and safely.